This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine your blood vessels are like rubber garden hoses, and your heart is a hard-working pump pushing water through them. During a heart attack, an MI, or myocardial infarction, one of the tiny fuel lines supplying blood to the heart muscle itself gets blocked. The heart muscle starts starving for oxygen, which causes intense chest pain. When first responders or paramedics show up, one of the most powerful tools they have is a tiny pill or spray called nitroglycerin nitro. Here is how it works, and why paramedics have to be incredibly careful when using it. 1. How nitroglycerin works, the mechanism. Nitroglycerin is a powerful vasodilator, which is just a medical word meaning it relaxes and opens up blood vessels. When a patient takes nitro under their tongue, it breaks down into a gas called nitric oxide. This gas signals the smooth muscles wrapped around the blood vessels to relax. The big pipes open up. It mainly opens up the big veins carrying blood back to the heart. Less weight to lift. Because the veins stretch out, blood pools in the legs and body instead of rushing back to the heart all at once. This reduces preload, the amount of blood filling the heart right before it squeezes, giving the heart a break. Less blood flowing in means the heart doesn't have to stretch or work nearly as hard to pump it out. Because it's working less, it needs less oxygen, which relieves the chest pain. 2. Why paramedics need baseline vitals first. Before a paramedic ever gives nitro, they must take the patient's blood pressure and heart rate. If you suddenly open up all the pipes in a plumbing system, the pressure drops. The same thing happens in the body. Nitro will drop a patient's blood pressure. If their blood pressure is already too low, typically below 90 or 100 systolic, giving nitro could crash their blood pressure completely, causing them to pass out or stop breathing. 3. Why an IV must be established first. Because nitro can drop blood pressure fast, paramedics always want an IV, intravenous line, in the patient's vein before administering the drug. Think of the IV as a safety net. If the patient's blood pressure plummets too low after taking nitro, the paramedic can immediately hook up a bag of saline fluid and pump it directly into the bloodstream to fill the pipes back up and restore pressure. 4. The danger zone, right ventricular, RV involvement. This is the most critical rule in the paramedic playbook for chest pain. Your heart has two main sides. 1. The left ventricle, LV the heavy lifter. It pumps blood to the entire body. 2. The right ventricle, RV the weaker side. It just pushes blood next door into the lungs. Because the right ventricle is thin and weak, it can't squeeze very hard on its own. It relies entirely on preload. It needs a constant, heavy stream of blood flowing back from the body to stretch it out so it can snap back and push blood forward. If a patient is having a heart attack that affects the right ventricle, which paramedics look for using a 12-lead ECG, the RV is already struggling. If you give that patient nitroglycerin, you dilate their veins, pool the blood in their body, and cut off the preload. Without that incoming blood pressure to fill it, the damaged right ventricle completely collapses. The patient's blood pressure drops to 0 instantly. The golden rule: if the 12-lead ECG shows the right ventricle is failing, nitroglycerin is completely off the table. Instead of relaxing the pipes, these patients actually need more fluid via IV to keep that weak pump moving.